Hi, everybody. This is Dr. Scott Worden, the TOS guy, and we are live streaming from beautiful Sunnyvale, California. I have an announcement to make for those of you who are interested. We have a new professional acquaintance, Dr. Sam Ferris, and his team at the Mayo Clinic in Jacksonville, Florida. And as you can see in the banner on the bottom, he's going to be our guest on July 7th at the same time, 4:30 p.m. Pacific Standard Time, to discuss their protocol and their approach to TOS. And because he's at such a great institution and because we've spoken to him, we understand he has this very detailed protocol. It will be a very interesting talk. Now, I'm going to take a step to the side. You may have read in some of our blog posts, we had written about Victor Wembanyama having TOS. And those blog posts included several other athletes who have been diagnosed with blood clots from various causes. We hope it was educational. We discussed the kind of blood clots that people get in their legs and sometimes go to the lungs, what's called a pulmonary embolism, and the very different kind of disease process that causes a blood clot in the subclavian or axillary vein, what we would call the classic type of venous TOS. But the cool thing, the amazing thing is, first of all, Victor Wembanyama is back. So great for him, great for basketball, great for his doctors. I'm sure they're super happy with the outcome. I'm sure the only people who aren't happy with the outcome are the teams that play him, because he's been really amazing. Not only did he come back, but he's as good as ever and better. And it's just a thrill to watch this young guy do so well, especially after being diagnosed with Thoracic Outlet Syndrome. Now, today we're going to hit another 5 common questions we hear from doctors or patients about TOS. And let's go right into our first question. Can Thoracic Outlet Syndrome come and go, or does it usually get progressively worse? Now, as you may have heard me talk about before, the symptoms of TOS arise before we can detect any nerve damage on electrophysiologic studies, what people call an EMG and a nerve conduction velocity test. Those are almost always normal in the early to mid stages of TOS. And MR neurography, you may have heard some people use those types of imaging techniques that specifically look at nerves. Those are typically normal as well when patients have symptoms. What happens is the symptomatology arises when people are in a stressful position. Let's say they use a non-ergonomic workstation at work. I've had that experience myself, and it's tough. But let's say they work with their arms over their head. Any number of reasons that are involved with occupation. Also with athletes, overhead athletes, swimmers we see a decent amount of. Baseball pitchers we see a decent amount of. Third basemen in baseball sometimes do, because they have the hardest throws from the infield position at least. And what happens is people will get their symptoms. They are almost always sensory symptoms at first. Pain, numbness and tingling, dysesthesias, which are bad sensations, like burning when you're being touched with something soft. And they don't progress to having motor symptoms like weakness of the hand or poor coordination of the fingers or atrophy of the hand muscles until later in the course of the disease. This is for a number of reasons, but the key element is that patients usually get symptoms. They'll get them while they're working, then they stop working or doing their athletic skill, and the pain and other symptoms go away. Then, as the disease progresses over a longer period of time, the symptoms will persist even after the activity is stopped, and it'll go away at night. But then as the disease progresses, we find that patients get the pain lasting overnight and sometimes waking them up until the pain is essentially there 24/7. And this correlates with what we know about the disease mechanistically, that it's this repetitive compression or tension on each brachial plexus as it passes from the neck through these series of tunnels to reach the arm. Now, overall, the pattern is one of progression, but during a single day, it can come during the activity and then fade away, but it takes more and more of each day. Second question, can TOS symptoms mimic other conditions like carpal tunnel or a pinched nerve or shoulder injuries? To a certain extent, TOS can mimic other conditions. We have noticed a decent amount of our patients during their workup prior to seeing us have had shoulder MRIs. Their doctors think that there's something with the rotator cuff. And usually I think that's clinically distinguishable from TOS. Please recall, a lot of doctors don't see TOS patients, or if they do, they don't recognize the disease for good reasons. It's taught to them in medical school little, if at all. That was my experience. I don't remember anything in 4 years of medical school on thoracic outlet syndrome. So you have to be lucky to have someone in your training who takes an interest and teaches you. A lot of orthopedists don't have that. They're concentrating very heavily on their skill sets. In this case, being a good shoulder surgeon, which is hard to do. In addition, MRIs of the shoulder exclude a good part of the brachial plexus and thoracic outlets. So MRIs of the shoulder done during these periods often don't show TOS. But clinically, I think the motion of the arm is different when it causes TOS versus when it causes symptoms in the shoulder. Secondly, carpal tunnel syndrome was mentioned in this question by several patients. And carpal tunnel syndrome, which is where the median nerve is pinched as it crosses the wrist, similar to a TOS mechanism, and cubital tunnel syndrome, where the ulnar nerve is pinched in the elbow, often by the same kind of mechanism as in TOS. Those syndromes can be very similar to TOS, and sometimes TOS can show up as carpal tunnel syndrome or cubital tunnel syndrome. So it is implicit for most docs that when they diagnose one of those two conditions, carpal tunnel syndrome or cubital tunnel syndrome, that they check proximally and make sure they rule out TOS because of that mimicry. And that's something we call double crush. When you press on a nerve proximally, let's say in the thoracic outlet, the nerves distal to that can become oversensitive and become painful by themselves, even with normal amounts of pressure. One of our guests recently, Dr. Harvey Chim from LSU, talked about this, that oftentimes they will plan to go ahead and not only do thoracic outlet decompression, but in many cases they will decompress the cubital tunnel and or the carpal tunnel to prevent this kind of multiple crush syndrome. Number 3, how long does it typically take to get an accurate TOS diagnosis? There is very little data on this in the literature. But if you go back and you read the literature way far back, and if you've seen patients, as we have here at Vanguard Specialty Imaging, you'll see that we used to get a lot of patients who had gone 5 years, 10 years, 15 years without a diagnosis. That was difficult for us because it's a lot harder to make progress and treat people when they've been going that long for a number of reasons. The nerves may be permanently damaged. The motor nerves may be involved, which doesn't occur in early or mid TOS. And the patients, their central nervous system remodels so that they kind of accept the pain as a new baseline normal. So there are a lot of things we've learned in the meantime, and there's been a lot of awareness that's been raised. Hopefully we've contributed to that through all the educational things we do. But I know places, very elite places like Harvard Medical School, Massachusetts General Hospital, with Dean Donahue and Yingwei Lum at Hopkins, and Hugh Gelibert in Los Angeles at UCLA. These are people who have been working on it for years, and they've had clinics. There are now many university clinics for treatment of TOS, and many docs who go in the community and work there rather than in universities. So I think we've got an increased level of awareness for doctors. And even more important probably is we've got patients who are more aware. We get lots of patients reaching out to us who actually learned to search for TOS. Who would have thought, 10 years ago, patients didn't know thoracic outlet syndrome. They would search for neck pain and arm pain. And there are so many millions of results from that it was hard for patients to find thoracic outlet syndrome. But now they do. Now they come and see us. They see videos like this, and they say, that could be me. So I think that the accurate TOS diagnosis period is much shorter now. And I also think it's more accurate because of things like what we do with our specialized imaging, as well as what we do by communicating with other doctors around the country, as well as by the new attention to these guided muscle blocks, like an anterior scalene muscle block or a pec minor muscle block. So we have some new tools. We have more awareness in the community, both patients and physicians. We have diagnostic imaging that's working really well in conjunction with doctors. and we have these selective muscle blocks. And I think that all of those things together have given us more accuracy and an earlier diagnosis, which I believe is leading to better outcomes. So all of you should be helpful. And I'm going to say right now, because of that awareness, because we're always trying to raise awareness, I'm going to ask each and every one of you, if you haven't subscribed so far, please subscribe. Please comment if you want. Please press the bell that alerts you every time we have a new program coming up. All of those things help the algorithm to find us more easily. And mostly, it'll help new patients find us. You're already here, but there's a lot of patients out there haven't found us yet, and we want them to. Question number 4. Can poor posture or desk work contribute to thoracic outlet syndrome? I know that many of you watching will know the answer to this already. It's absolutely true that spending hours on a computer or at a non-ergonomic workstation can lead to this type of repetitive stress injury. That's a broad category. TOS in that situation is one of them. There's also TOS caused by trauma, TOS caused by athletic events and activities. But working at a desk, especially a laptop or an iPhone or an Android phone or a tablet, it never puts you in a good position. You can't, with a laptop or anything smaller, separate your hands and your head and neck in opposite directions, as is recommended by every person who's an occupational therapist or a physical therapist or a doctor. So a desktop even doesn't do it unless you get one of those keyboard trays that goes under the desk and you raise your monitor up near eye level, at eye level, maybe 15 degrees below, which is just a little bit. So you really need your forearms relaxed and down at your waist or below. Nobody does that, including me. I'm just too busy to do this. And you need your eyes and your head and neck in a different position. And if you don't do that, you're going to start rolling your shoulders forward, which many of you know about already. And that starts changing the spaces in each thoracic outlet, and it can lead to thoracic outlet syndrome. One thing I might recommend is that the speech to text tools that are coming out now, that used to be restricted to one dominant company, that was very accurate on Windows and non-existent on Mac. But now there's a lot of AI speech to text programs I've been experimenting with, and they really work well. They take my hands off the keyboard. They learn from you, so you can dictate email responses very quickly. And text, if you write any text, can do that very quickly. They're still improving, but I've been using them, and the accuracy is getting better and better and better. And that takes your hands off the keyboard a lot. Number 5, is thoracic outlet syndrome considered rare, or is it simply underdiagnosed? So many of you may have heard the story before I told about the history of TOS in the late 80s and early 90s, when David Roos, the surgeon from Denver, Colorado, who was making great progress with TOS, and a neurologist from Cleveland Clinic, Asa Wilborn, got into an argument in the literature. Asa Wilborn said, when you do an EMG on these folks, it's completely normal, and therefore they're faking it. Maybe they want something from work comp. I don't know, but it's not a real disease. What I'll say is this. Asa Wilborn said, if they have atrophy of their hand muscles and all the other symptoms, I'll agree that is neurogenic TOS. But if they don't have atrophy of the hand muscles and their EMG studies are negative, they don't have TOS. I'm going to call that disputed TOS. Now, that's a word that's filled with emotion. It's not very objective like most scientists are. It already in its name, it's disputed TOS means, maybe it's not real. And a lot of neurologists followed Asa Wilborn and said, I don't need to know much about this until it's proven. The absence of evidence is not the evidence of absence. And it wasn't necessary for everybody to prove the existence of the disease. There was plenty of evidence. We're still incomplete in how we diagnose it and how soon we diagnose it. And different doctors have different opinions, but we're a lot further down the road. That doesn't stop us from investigating further. So what we end up with is this controversy of how common is TOS. According to Asa Wilborn, it would just be the true neurogenic TOS where people have atrophy of their hand muscles. It's too late then, folks. Once you get motor nerve damage and you start getting atrophy, it's very unlikely that you'll regain that function. The muscles won't recover, the nerves won't recover. That's not our job as doctors to wait when we have an entrapment neuropathy. That's what TOS is. When you have an entrapment neuropathy, you treat it early. You look for signs of motor weakness or motor nerve involvement. If you have that motor nerve involvement, you got to act even more quickly. But for TOS, for some reason, this guy wanted us to wait until the EMG turned positive, which takes a long time, and for the hand atrophy to develop. But by that point, treatment would be useless. So there's a lot less of this disputed stuff today. In terms of the incident of TOS, I read through a bunch of papers. Somebody quoted somewhere that it was 80 in 100,000 people. I think Dr. Jason Lee quoted that. But every source I could follow backwards from that paper led to a dead end. Probably the best study was done by, Carl, I've got to remember his name. He was at University of Tampa doing TOS surgery. And he actually, because it's a fairly large city, recorded people who came in and at least got his diagnosis of TOS. And he came up with less than 80 in 100,000, but not super rare. Like some people have said in the literature, 1 in a million. If you go back and look at all the incidence reports, no one is accurate. There's no baseline they're establishing it on except this one paper from Tampa. And I'll think of his name a little bit later. Illig, Carl Illig, Illig. The other thing is there is no accepted gold standard for the diagnosis. There is no single test. We love our test. We know what it does. It works with doctors and goes together, just like a herniated disc in the spine needs to be at the right place, right level, right side. Okay. And then it's got to match those clinical findings. If you have a herniated disc that's huge on your right side and you have pain in your left leg, that doesn't match. That's the way we practice medicine with imaging. And so our imaging is great for this, but I'll tell you, it's not, and it never can be 100% because a lot of these things people are born with. They're born with an extra muscle, okay? And they don't get symptoms until they stress that space. So we don't have a gold standard, and we are getting better at it, but nobody knows the true incidence. In my educated guess, I think it is mildly to moderately common, and I think it's getting much more common because of computer use and because we're recognizing it better. A lot of athletes get it. So that's the kind of convoluted answer to question number 5. Now I'm going to throw in one bonus here, number 6, because it's a nice even number, because it's sunny out and because I'm in a good mood. So our bonus question, when should TOS symptoms be considered urgent? Most of our patients come to us and they don't have an emergency situation or even an urgency situation. With neurogenic TOS, pure neurogenic TOS, or TOS with a little bit of venous component, there is no urgency. You don't have to rush to the ER. But the signs of TOS that could be really urgent would be, number 1, most of all, arterial TOS, which is only 1% of all cases. It's where an aneurysm forms or a stricture, a narrowing, a scar in one of the subclavian or axillary arteries. A blood clot forms on top of that from the damaged wall, and then the blood clot either blocks the blood flow right there, or it breaks off and blocks arteries farther down the arm. That means the arm's not getting blood flow, not getting oxygen, not having all the carbon dioxide and the side effects of metabolism taken away so easily. That is a surgical emergency. Otherwise, that tissue can die if it's not treated fast enough. We never see those patients. I rarely see a patient with an aneurysm or a stricture in the artery. It happens, but not with a blood clot. It's a very dramatic clinical presentation. People's arm will turn white or blue, but usually white. They won't be able to feel a pulse. The arm will be really weak. You might have experienced falling asleep on your arm. That's what it feels like. Those people go to the emergency room. They get treated very promptly. Secondly, venous thoracic outlet syndrome, maybe 2 to 5% of all cases of thoracic outlet syndrome. In that case, the blood flow goes through the arteries, reaches the arm, and when it comes back, it meets a big blood clot in the subclavian or axillary vein. Now the blood can't flow so easily. It finds some smaller new channels, what we call collaterals, and they show up on the chest wall as a spider web of dark blue veins. The arm swells, it feels heavier, it feels tight, it may turn blue or purple. Those patients go to the ER and they get pretty urgent treatment. I would say it's not as emergent as arterial TOS patients, but it is fairly urgent. The docs try to confirm a blood clot with ultrasound. They don't need an MRI at that point. Then they treat that blood clot. Some people will actually try to remove it with a little catheter. Other people will treat it with just a simple blood thinner like Coumadin. Other people will use a more aggressive blood thinner like TPA to try to dissolve it more quickly. Okay, so urgent TOS is arterial TOS, that's emergent, or venous TOS is urgent. But neurogenic TOS is not urgent without those findings. And that's question number 6, our bonus question. Have we got any questions from our viewers? And we do. Jeff G. Hi, good afternoon for you. Good evening, good morning. My symptoms are really only bad when I sleep. Though I know they are there, does that make sense? I have not been diagnosed with TOS, but I'm pretty sure that I have it. So a guy named Thomas Wingate Todd was sure that the sleeping position could affect people's arteries and give them this neurovascular syndrome. So he slept with his arm over his head for, I think, 8 years. And at the end of 8 years, he finally developed arterial TOS, I believe. So it can happen with the arm up over the head. You know, Thomas Wingate Todd was a professor. He's one of one, just a sample size of one. That doesn't matter. But with your arm over your head for anything, we know that it narrows the thoracic outlet. So it can compress the arteries, the nerves, or the veins. Now, I can't give specific diagnosis, of course, by the internet like this in a public forum. But if you believe you have TOS, certainly you want to notify your primary care doc. Hopefully they'll just read a little bit and try a couple of provocative tests and move your arm around and see what happens to your pulse or if you get symptoms. And then hopefully they can refer you to a specialist. Depending on which part of UK you live, we might be able to help you find somebody. But if you're facile at all on the internet, do a search that way. So yes, arm position during sleeping can bring on the symptoms of TOS. Thank you. That's nice. I love this channel. The videos are so helpful. I fell on my wrists and broke both of them. Can that result in TOS? It's only on one side. Jimmy from San Diego. All right, Jimmy, thank you for the question. It's not breaking the wrist that would do it, and I don't think that's what you're saying, but the impact of landing on the pavement, if the impact was large enough, yes, that can cause thoracic outlet syndrome. It would be similar to a car accident. What we see in car accident victims who get TOS is they're often struck from behind, a whiplash type of injury that doesn't go away, or they're struck from the side, a T-bone type of injury. So what happens is when you fall, you're sending this jolt of energy through your arms into your shoulders, pressing the collarbones against the ribs. Your also head and neck are going to go forward and they're going to jerk when they get to the limits of the motion as your muscles determine. Your muscles are there to stop that kind of thing. But oftentimes with that sort of injury, a sudden movement of the head and neck, like in a car accident, can injure the scalene muscles and the stabilizing muscles of the neck. So not a direct reason from the fractured wrists, but if you did break both wrists, it suggests a relatively high impact of falling that may be similar to a car accident. And if you reach out to us at tosmri.com, we have a big contact button in the top right, and we're happy to talk with you further and help you out. And thank you for the question, Jimmy. Thank you for the compliment. We're glad it helps. All right, Susan from Georgia. My daughter is a swimmer. No trauma that we are aware of. Her doctor suggested TOS. Is it likely? Will she have to stop swimming? Are there any good doctors in the Atlanta area? Susan, first of all, sorry to hear your daughter's having symptoms. We can help you. Again, I want to remind you, we can't give specific medical advice, but swimmers, young swimmers particularly, get TOS with some frequency. We do see neurogenic TOS with regular frequency. I'd like to know which doctor suggested this, if they have experience with TOS or not. But that's great that they suggested it, because then you can go down the pathway to diagnose or to rule it out. And fortunately, in Atlanta, there's a great team at Emory, Dr. Robbie Bowers, who's a sports medicine doc, and Dr. Eric Wagner, who's an upper extremity surgeon. And if you reach out to us, tosmri.com, we can give you their contact information if you can't already find it. There are other docs we can send you to as well, but you're lucky being in Atlanta. These guys are very experienced. They're young, they're progressive, And we found a lot of our patients have really gotten a lot of value out of visits with Dr. Bowers and Dr. Wagner. I am 70 years old. Is this within the age range for TOS? So anything is possible. The literature shows that there is a specific period of time in one's life because the shoulders gradually descend over time and the ribs gradually move forward over time. Uh, Usually it's in women more than men, and usually it's in the age range of, I'd say, 25 to 40. Now, it doesn't mean it's not possible. And it's almost a moot point because if your doctor examines you, he or she should try some of these provocative TOS tests. If you have it, you have it. You know, there are a number of things like if you had a collarbone fracture that healed in the past, or a first rib fracture that healed in the past, or you're one of those people with an extra muscle or two taking up space, it can certainly happen. And the other things I would ask you if I were your doctor would be, have you taken up any new hobbies? Maybe you're playing tennis or pickleball. Maybe you decided to rock climb. You know, people do a lot of good things nowadays. So I think it's possible, but it's less likely. The typical patient is 25 to 40. Again, reach out to us. We're glad to help you narrow it down. Thank you. Okay, those are the questions for today. We want to remind you that Sam Ferris, Dr. Sam Ferris, who has a really organized team at Mayo Clinic in Jacksonville, is going to be our guest on July 7th. I think that's well worth watching. He's very educated, very knowledgeable about TOS, very organized, nice man, definitely worth seeing. So put that on your calendar or hit the like button for this video and then subscribe and hit that little bell button. That bell button will tell you every time we have a program coming up, and you'll be able to be notified and join us for the next one. And again, this is Dr. Scott Worden, the TOS guy. Don't guess with TOS. Okay, talk to us at Vanguard Specialty Imaging. We do the NeoVista MRI. We consult with people to help them figure out what's going on and what their next best steps are. And we look forward to meeting any and all of you. For now, take care.
There was one more coming in.
One more question.
Yeah, there was.
I just saw the no more like 5 times.
Yeah. Oh, that was that. It's because it posts to every single thing, but it doesn't go up on the video unless I actually put it there, right? So
no, it doesn't. I didn't see it on the video.
I only put it there briefly for you, and when I realized you were moving on, you didn't need me to tell you. I just removed it really quickly.
Oh, the question was it an interesting question?
I don't know yet. It's not. It never came through, so I don't know if it was me. Like I don't know.
Okay.
Yeah, those 3 of those were just quick questions I put up to try to spur questions, obviously, because no one normally by the time you get to the end, there's at least one question and I don't have to deal with it, right? But yeah, I was like, I knew when you got to 6, I was like, well, I better recycle some questions. Right on. Why are you so tired?
It was a very long weekend. The Kung Fu tournaments, I was on my feet for, I think, 14 or 15 hours on Saturday for Kai's thing. Sunday, so it was the whole weekend. Sunday, I just spent a lot more time in the bleachers. I brought my computer to try to get some work done. But again, I had to be up a lot and roaming around taking care of the kids, getting them something to eat. So, and then Sunday night, we put on a last-minute barbecue because one of our friends, she just graduated from interior decorating school. And so JC and I, JC amazing. We went to the store and in like half an hour, we planned a big barbecue. We got everything we needed. Tracy's like, I'll go in and buy one thing. And she comes out with 5, even stuff awesome. She doesn't want. Tracy's like, oh, I don't like this at all, but it's 2 for 1. So, and JC and I were super efficient. Yeah, we just blasted through and got everything we needed, although I forgot relish for the hot dogs, but it didn't matter.
No one cared, I'm sure.
Nope. And then we had a barbecue, and then and I ate and drank too much over the whole weekend. Um, we just didn't stop running. We had kids over Saturday night and Sunday night. Um, Took the dog to the dog park, and then also I think because I was taking the steroids, the prednisone, I think I'm crashing after finishing. My adrenal glands probably shut down. You know how that works.
I do.
So yeah, so I'm trying to recover. I'm still going to the gym with my private trainer, and then today we started a pretty harsh diet. We want to lose some weight because we both feel physically tired. That's it.
Good,
No
good.
complaints. Yeah, I have been working with these voice programs, and they're getting better. And I'm trying to figure out which is best to use. I don't know if it's worth bouncing off of you or not when you have time. But anyway, I've been dictating a lot of emails, and boy, it's faster, faster, faster. Definitely good.
Way faster. Not even close, right?
Yeah, for years they didn't have anything good on a Mac. I had tried for years to make this one program work. It was, forget what it was called, Mac Speech. It was made by Nuance, but they didn't work within the program. So if you move the cursor, it didn't know where you were, and it was just gobbledygook. And Nuance, company that owns Dragon Medical, they were just terrible. Their customer support sucked. So that's why I have to go through this whole thing of having, a virtual machine. I told you that before.
Yeah.
Anyway,
Fantastic.
either one I use, I think will be okay. It's just one of them, their technical support is really slow, and it keeps answering me with AI bots. The other company, I had a great conversation with this sounds like a young woman, and I figured out like 8 emails into it that she was AI as well. I was like, how did you respond so fast? So it must have been because you're using this speech software.
Oh God, that's
But no, I
hysterical.
think it's because she's an AI bot. Because at one point, another guy jumped in and he said, "Oh, those last answers you got aren't totally accurate. You can really do this instead." He phrased it in such a way like, Debbie didn't give you the best advice on that. It just sounded funny, but
Cool. How'd the
all
kids
right.
do it? How'd the kids do it? Kung Fu, pretty good.
Uh,
I saw the videos of JC, but I didn't see if you posted any of Kai.
I did.
I probably just never popped up on my feed.
So they each were in 4 events. They each got 3 golds and 1 silver. So
Very cool.
they did well. JC made a mistake. She really wanted to go for grand champion, which means you have to have the most points. They did this differently this time. Instead of doing one event, waiting 2 hours, another event, you had to wait a really long time, but then you did like one event every 12 minutes or so. And so her third event, she got confused about which weapon she was using, and she did the wrong routine. She did great. It's the one with the chain that you whip around, you whip under your body and all that. And so they took off some points for her for doing the thing out of order. And the woman just said, "Don't worry, you got the gold anyway," and then just had her do the third place weapon during her 4th slot. Yeah, I mean, I think she felt well with it. I think what we're at a point now discussing how much time she puts into that versus putting into wrestling.
Right.
She's to move further in Kung Fu will take a lot of time.
She's got some decisions to make, right?
Yeah, but I mean, she earned a black belt she was 13, and Kai's going to do it younger. I mean, it's